Good morning. It's Dr. Sloan, better known as OrthoDoc. Today, let's talk about some symptoms. Symptoms that you may feel when you're at work or you're in an environment that is professional. And these are things that you feel like when people are talking over you or looking past you, or perhaps you don't get the assignment because they give it to someone else that they may deem as better for that task. So this diagnosis comes up as bias, and this is something that we deal with in medicine on a patient level, on a professional level, on a systemic level, and it can be conscious or unconscious. And so this is sometimes subconsciously, untrained. These people may not even be aware that they are doing these things. And so how do you deal with that? Number one, you have to be very strategic in your language, your attitude, as well as your communication. So I would tell you to work on specifically identify your feelings about it, and have a clear conversation with yourself and maybe somebody else you trust, and like, hey, is this really what I'm feeling or what I'm seeing? And then secondly, create a language that will be professional as well as strategic to get what you want. So therefore, if you want to be in the operating room as a medical student or a resident, and you feel that attending has not given you the opportunity because they may have some unconscious bias, then you may bring it to their attention of like, I would love to be in the operating room with you to learn from you. Is there something that I can do differently that may bring a better chance for me to do that? And so that will put it on their radar that they haven't given you the chance, perhaps. And then lastly, not just the communication skills, but how you deliver it, what you're saying, the tone that you're saying in it, and even your facial expressions, because sometimes that person may not receive what you're saying if they feel that it's an attack. So even though it is not your burden to bear, it is. So symptoms, bias. That's the diagnosis, and I've given you the prescription on how to deal with it.